Hey, Savvy Beauties. It's your girl, Crystal P, the Beauty and P. If you've been watching this little series I've been doing, then you know I am out of town in Puerto Vallarta, Mexico, and you could probably hear the waves in front of me. I'm obsessed. If you look here, you'll see blue waters in front of me here over my balcony. But this has inspired me to just make some content for my ladies out there who watch my videos. I love that I get nurses who are looking into entrepreneurship and then they stumble onto my hormone therapy videos and they're like, I need some of that too. So shout out to all of you. And that is why I am not changing this channel. It's just going to be Crystal P, the Beauty and P, and I'm going to talk to you guys about all things beauty, entrepreneurship, for my nurses and for those who aren't nurses, just giving you the rundown of different beauty treatments. And if you've been watching my videos, you know my favorite is hormone therapy. So today we are going to talk about the side effects of hormone therapy. And I first want to preface this video by saying there are side effects to anything that we take, anything that we are not born with, that we put into our bodies is going to have some sort of side effect. It may have a side effect. It may not have a side effect. It may have it may have a smaller side effect on some and a greater impact of a side effect on others. So I'm going to talk about the side effects, but please know that with hormone therapy, 99.9% of the time, most of the side effects do not outweigh the benefits. So no one is like, these side effects are too much, I can't take it. Most people are like, yeah, I have a few of those things, but the benefits that I feel amazing. So we're going to roll with it, and we're going to wait until it passes, because most of these side effects do pass. If there is anything we need to adjust, we can just increase or decrease your dosage when it comes to your hormone therapy, and then we can mitigate a lot of these side effects. But when you are first starting, please know that if you watch my last video, it is a journey. So that's where the journey comes in. We are trying to get things back balanced. They've been unbalanced for so long. So please do not fear that it may take some time before we can get everything perfectly aligned, okay? So when we're starting estrogen therapy, so not all women are going to get estrogen. Estrogen is mostly given to, now estrogen cream, everyone can have that. But if we're going to give you estrogen in the form of pellets, if you're going to be using it as a cream other than vaginally, if you're going to be using it as an estrogen cream where you rub in your inner thighs, or doing a pill or a patch with the estrogen, or a pellet, then these are the side effects that could happen. And again, we only do that mainly with menopausal women, but also some women who are perimenopausal, but close to that time, your periods have been skipping, you're still having them, but it's months and months apart. We may give you some estrogen systemically so that you can start feeling the benefits of having estrogen running through your body again. So some of the common side effects for estrogen could be some nausea, could be some breast tenderness. We know that when first starting estrogen, or if you're getting too much estrogen, you can have some breast tenderness. This is also in men who are getting testosterone. Sometimes testosterone can convert to estrogen, and then men start complaining of some breast type tenderness pain. But for women, we can have that as well. Bloating is common, because especially within the first 2 weeks of therapy, you're going to retain water and you may feel bloated. Again, usually goes away within the first month or so. Really by 3 months, you shouldn't have those worries anymore. Could increase your blood pressure. You could have some vaginal bleeding. Again, increasing the estrogen. Estrogen is what kind of sparks you having your cycle. So we will counteract that with some progesterone, but we may have to increase your amount of progesterone before you stop bleeding. Usually bleeding subsides within the first 10 to 14 days of starting on estrogen therapy if you are to bleed. And the way I mitigate that is by starting my clients very low on estrogen, because the last thing you want is a menopausal woman bleeding, because she doesn't want that. You could have some mood swings, especially if your estrogen is too high, because estrogen is what typically affects your mood. So you could have some mood swings, could have some weight gain, again, due to the water retention. And then they have increased risk of blood clots. That's really if you are someone who's already prone to blood clots. And also, just like the birth control pill, taking estrogen orally could increase the chances of blood clots. But if you are not someone who has blood clots, then you don't have to worry about that. So for testosterone therapy, which is what women typically get either with estrogen or by itself, with testosterone, you could notice some acne, so that could happen. I always say it's maybe extra 2 bumps during that time of the month, but you could get some acne, again, fluid retention, weight gain, bloatiness, increased urination. You can have that. You could have some skin irritation, and that is mainly if you're using the patches or the gel. The testosterone could irritate your skin. For men, they could have a lower sperm count, especially when first starting therapy. You could have increased aggression or mood swings, and you can also have, for women, you can have what's called clitomegaly, which is an enlarged clitoris. That can happen if your testosterone goes too high. You could also have some, I don't think they listed on here, but you can also have some facial hair. And those are pretty much the symptoms with testosterone. Again, it's a few hairs. You're not going to grow full beard, and the benefits greatly outweigh the side effects. So there's some of the side effects you can get when starting hormone therapy. Again, especially from my practice, I try to start my clients low and slow. We can always add more, but we cannot take away, especially when we're doing pellet therapy. So I like to start you guys slower so we can mitigate some of these side effects, because I want you to have a smooth ride on this journey to hormonal balancing. So if you have not already, please go ahead and download my hormone symptom tracker. It's a 90-day symptom tracker where you can either provide that to me, or you can provide it to your primary care provider or your menopause provider during your consultation, and they can see what you have been going through for the last 3 months, and that can help tailor and guide the therapy that we use for you, since it's patient specific, bioidentical, so we can tailor a treatment program that works best for you. So if you like this video, please go ahead and comment, subscribe, and go ahead and leave me a message letting me know that you like this, or if there's any other videos you would like for me to do. All right, everyone. Hope you enjoyed.